can you just introduce yourself and give us a brief background on your professional history today?
Yeah, so my name is Paul Ashley. I am a professor in paediatric dentistry at UCL Eastman. My background is I trained in Manchester and then went on to do a PhD there in caries diagnosis, moved to the Eastman in 1998. Like I said, I'm a paediatric dentist, but I now I'm academic lead for the paediatric programs there. I also work as an honorary consultant at UCLH. So it's a kind of mixture of clinical and research.
Right, okay. So UCL has recently launched the paediatric dentistry for non-specialist course. Why did you develop this new course?
Yeah, so we started off when I started at the Eastman about 20 years ago, providing 2 to 3 year courses for people interested in specialist training. And then we moved on to that to try and offer something for dentists who can't take that career break. So we moved on to deliver an online MSc for people who wanted to learn a little bit more to get an MSc but didn't want to or couldn't commit to 3 years full time. And this new course is really kind of trying to give a little bit of information again for dentists or professions allied to dentistry who want to improve their skills in treating children, don't perhaps want to go as far as kind of like tier 2 or special interest training, but want to learn a little bit more. And we chose the FutureLearn platform because we knew we could offer this training for free if people want to do it. They can do it in their own time, they can do it in evenings. And I think our goal is, it's a little bit of a labor of love, it's probably fair to say. Our goal is to try and I guess democratize, try and open up the training that we give to a broader pool of people, not just in this country, but internationally as well.
So just excuse my ignorance, can you just explain what the FutureLearn platform is?
Yeah, so FutureLearn is what's called a massively open online course. And it's designed to open up access to high quality online training to anyone who's got access to the internet and a computer or a laptop or an iPad or a phone or whatever device you have. So the reason, so obviously I work for UCL and UCL as a partnership with FutureLearn, and the reason we did this on FutureLearn is really for this to get this course out to as many people or make it available to as many people globally as possible. So it's trying to, like I say, really make our knowledge, our learning available to as many people as we could, because we really want to try and improve the management of children by dentists and therapists and hygienists, etc., working in any setting, because at the end of the day, most children will end up seeing somebody in a primary care setting. They won't come to hospital. They won't come to a specialist setting. So that was the vision.
Yeah, okay. And so what exactly does the course cover and what's involved?
Yeah. So the course, it's notionally set over 3 weeks, though it's only really a few hours per week. And we kind of cover what we think are the really important things. So we talk a little bit about caries management, prevention, hall crowns, a little bit on silver diamond fluoride. We talk about emergency management of dental trauma. So I think a problem that dentists can sometimes struggle with is a child presenting with a tooth they've banged on the playing field or they've fallen over. We talk a little bit about behavior management, and we specifically focus on delivering local anesthetic, because I think that skill of giving a dental injection is actually probably one of the most tricky ones, but one of the most important ones I think you have to develop if you want to treat children successfully. And then we kind of wrap everything up with a little bit around treatment planning. The course is designed for learners to talk to each other. So we had lots of really good engagement between learners in the first run, and they're sharing their experiences. And then we drop in from time to time, and we might add a little bit here and there just to add to the conversation, or maybe tweak some things if people have made some good suggestions. So that's how it looks.
Okay. So I understand the course has been incredibly popular so far. What type of students are enrolling on the course?
Yeah, I think we're on to our second run. We've had, I think, over 2,500 people log on so far. So I have to say we're really, really pleased with that, because the numbers we normally deal with, are 30 or 10 or 12 or whatever for the sort of more hands-on courses we offer. And I think the two things that have really stood out, well, actually three things that have stood out. I think first is the global nature, lots of people from the UK, obviously, but people from all around the world. I think it's the whole range of experience, from undergraduates to people who've been working for a long time. It's been very nice to see those interactions. And then we've also had some people from related but not dental professions. So presently we've got a paediatric, not dental nurse, medical nurse. So it's been a really lovely broad mix, because obviously the more diverse the people taking part in the course, then often the better the conversations and the comments you can get, and we can facilitate. So it's been a nice, a really good mix.
Yeah, brilliant. Okay. And obviously this is one of the many courses available at the UCL. Can you tell us a bit more about the education and research at the Institute?
Yeah, so if we're going to take a slightly broader look at the Eastman, obviously there's my own bit. So we run a 3-year full-time program, really probably aimed at overseas students wanting to do specialist status. We run a 3-year part-time blended learning MSc in paediatric dentistry, which is aimed at anyone who wants to do a little bit more but can't commit to full-time, and this. And then across the rest of the Eastman, clearly we cover all the different specialties, and again, for most specialties, a range of either full-time or blended learning. Clearly UCL is one of the leading universities in the world, and obviously the Eastman is a postgraduate only institution. So I think we believe that we've got a particular skill at delivering and developing the courses people need for that postgraduate study. And I guess, I mean, obviously, if people want to know more, there's too many courses for me to list now, but if you go to the website, you'll see them all there.
Yeah, perfect. Okay. And on that topic, do you think there will be any future courses available from the Eastman on FutureLearn?
Yeah, so that I think we're sort of a little bit of an experiment. I guess is probably the best way to describe it, and I think it's gone well. Obviously our success is being discussed at more senior levels than mine. There aren't any specific plans to open this up to different specialties right now, but I suspect if we continue to see the numbers of people logging and applying for our program, that we would hope to see more courses from Eastman for sure. Yeah.